Good evening, happy Memorial Day, and welcome to Chicago Tonight. I'm Phil Ponce. Brandis Friedman and Paris Schutz have the evening off. On the show tonight, what impact has the COVID pandemic had on veterans? We talk with two VA hospital doctors. Original artwork by one of America's greatest editorial cartoonists, Bill Malden, on view at the Pritzker Military Museum and Library. Festivals are set to return this summer. We have a rundown on what to expect. And our own Jay Shefsky gets friendly, maybe a little too friendly, with a rather large insect. First off tonight, as America remembers and celebrates members of the military who made the ultimate sacrifice, living veterans have struggled with another enemy, the coronavirus pandemic. Joining us now to talk about how veterans have fared over the past year are Dr. Jeffrey Oken, Acting Chief of Staff at Edward Hines Jr. VA Hospital in Maywood, and Dr. Sarah Unterman, ER Doctor at Jesse Brown VA Medical Center in Chicago. Doctors, thank you both for joining us very much. Dr. Oken, let's start by talking about mental health, because so many civilians and non-veterans have suffered through the pandemic. Reports of loneliness, depression, and so forth. And a new study on military veterans concluded that, quote, psychiatric symptoms and suicidal ideation are prevalent in veterans who have survived COVID-19. So during the pandemic, did you see more patients struggling with mental health?
We did. So the great thing about the pandemic and about mental health services are we can provide these virtually. So all of our veterans were able to get the care and the access to the care that they needed. So if they were having problems, they reached out. We could reach out to them either by VA Video Connect or by telephone to meet their needs. We continue to do that. Some are coming back and having face-to-face visits, but there are options for our veterans to get that care when they need it and in the amount that they needed.
But as I understand it, most of your connecting with veterans had to do Zoom or on telephone. Is that just as effective as meeting with veterans in person?
So, you know, it is. One of the things that we do encourage is a video visit where we can actually see the veteran. Many of their visits are short visits just done by telephone, but if they need a more extensive visit, we encourage them to be seen and to have that connection eye to eye.
Dr. Unterman, you're in the emergency room. What are you seeing in terms of people presenting with mental health concerns?
So we're seeing, we were very concerned actually about an increased risk of mental illness and substance use amongst patients, especially those who weren't engaging in care. But our virtual modalities, like Dr. Oken was discussing, have really helped with connecting our patients in ways that we hadn't been focusing on nearly as much prior to the pandemic. So we have been able to reach our patients in the places that they need and at the times when they need, which has really helped considerably. We did have a patient who came in just a few weeks ago who was an opioid user, and he came with significant signs of withdrawal. And one of the things that we had focused on during the pandemic was increasing the availability of buprenorphine or Suboxone availability at our facilities. And we were able to start this patient immediately on buprenorphine, set him up with primary care, have him come back the next day for changing his dose based on his symptoms. And we were really able to hook him up into the appropriate modalities that he needed to help him. And so we've learned a lot.
Excuse me, what exactly is Suboxone? Is that the phrase, the name you used? What is that?
Yeah, so it's one of the medications that can be used to help people who do use narcotics, specifically opioids, to stop needing non-prescription opioids and to prevent them from having severe withdrawal symptoms.
Dr. Oken, now that the CDC has issued its suggestion, its recommendation about masks, and there's a, quote, return to normalcy to a certain extent, is there any issues that you're seeing as we segue as a society to what appears to be a new phase?
So one of the things at VA and in all medical centers, we continue to have mandatory masking on our campus. We do have concern, obviously, as the mask usage goes down. We are optimistic that that means vaccination is up. However, we're still concerned and we're still prepared if we do see a surge in COVID cases because of the change in recommendations by CDC.
Dr. I'm sorry. Excuse me for interrupting. I thought you'd wrapped it up. But Dr. Unterman, are you seeing vaccine hesitancy on the part of veterans?
We are seeing some vaccine hesitancy. What we've found is most effective is to just keep talking about it with the veterans over and over. This isn't a one-time discussion that then you leave. This is a multiple discussion where you, at every single visit and every contact with the patient, discuss with them the positive reasons to receive a vaccine, discuss any concerns that they may have. And we've seen many cases of veterans who initially were skeptical, but over time have come to the conclusion that it's the right thing for them and their families.
Dr. Oken, back to you. During the height of the pandemic, some people may have delayed medical care on other issues, not just mental health. But are you seeing any sort of pent-up demand for health care on the part of veterans?
Oh, huge pent-up demand. I mean, it's really amazing. There are procedures that were put off, other care needs that were put off. Our clinics are full. We are getting our veterans in, both face-to-face as well as virtually, getting the procedures that they need done. But yes, there is a huge pent-up demand out there. And we are very fortunate that here at Hines, we've been able to meet that demand, both out in our community clinics as well as on our main campus in Hines, Illinois.
Dr. Unterman, both of you alluded to the use of telemedicine. Does the experience of the past year or so cause you to think that some of these changes might be permanent, greater reliance on telemedicine?
Oh, they definitely will be. When we talk about our clinics being full, which they are, we're fully back open and ready for all business in every specialty. We are not going back to the old model of everybody must come in face-to-face for every single appointment. We are going to maintain a significant proportion of our appointments as video appointments so that there's a greater flexibility for our patients, and it really helps break down barriers, especially for those who have trouble commuting to a facility. They may live far, they may not have good transportation. This allows us to meet patients where they are, literally and figuratively, so that they can continue their care.
Dr. Oken, according to Military Times, Veteran Affairs officials reported no new COVID-19 deaths last week across the country. Are you seeing fewer COVID-19 hospitalizations?
Oh, we are. I mean, the numbers have continued to go down. Our veterans continue to get more vaccinations, which is helping that. And I think they're also very, compliant, and they've been throughout the pandemic and wearing their masks and following social distancing. So yes, we are seeing a definite drop, but it is not zero where we are hoping and anticipating it will be.
Dr. Earthman, we've been focusing on COVID and its impact on veterans, but looking at the very big picture, what would you say right now is the most pressing health need that veterans face?
Well, it's hard to put your finger on just one. I think one big one is access to care, to ensure that they're receiving the specific type of care that they require in the time frame that they require it, and we've made huge strides in providing that care. Another is mental health and suicide prevention, which we're deeply embedded in, and that's one of our biggest focuses, and we have some of the most talented mental health professionals working for us so that we can address those concerns.
And that's where I'll have to leave it, Dr. Oken, Dr. Unterman. Thank you both for giving us an update. We very much appreciate it, and good luck with your important work.
Thank you very much.
Thank you.
And up next, we visit an exhibit featuring the work of cartoonist Bill Malden, who is well known for his work commenting on American soldiers. So please stay with us.
Good evening and welcome to Chicago Tonight, Black Voices. What do you believe prevents a strong coalition of Black and Latino communities forming across the communities?
I want us to, as a nation, to find a way to come together.
Go down the block, get it from someone local, and keep the money in the community.
Black joy and the Black experience is magical.
By the age of 23, he had fought in World War II, tangled with General Patton, and won his first Pulitzer Prize. Cartoonist Bill Malden created artwork for magazines, books, and newspapers from the 1940s into the 1990s. A new exhibition remembers this American original who had strong connections to Chicago. Producer Mark Vitale has the story.
For any issue facing the United States or the world at large, Bill Malden could sketch a strong opinion. For more than 50 years, he satirized the news of the day, and he didn't pull his punches. Now, the Pritzker Military Museum and Library has opened its archives of original artwork by Bill Malden.
You start just looking at these cartoons and going through, hundreds, thousands of them, and, you really gain not only an appreciation for the original pieces themselves, but certainly for his humor, for the subject matter that he's covering. I mean, he touched on everything. If it was important social, political, economic topic of the 1960s, 70s, 80s, or 90s, he probably touched on it. And he did it in such a, sharp, biting commentary that I think really only cartoonists can do sometimes.
Born in New Mexico, Malden studied at the Chicago Academy of Fine Arts. He started his art career while fighting in Europe during World War II. There he created Willie and Joe, two soldiers who came to symbolize the common fighting man.
Once he's in Italy, that's where the characters Willie and Joe emerge as distinct characters, and he'll continue to draw them throughout the remainder of the war and after the war as well. They are really representative of the average experience of the infantryman.
Malden's point of view was popular among enlisted men and people on the home front. But the scruffy soldiers he drew were not appreciated by some of the military brass, including General George Patton, who held a private meeting with Malden that the artist later depicted.
Patton kind of chewed him out over the cartoons and tried to get questions as far as what are you trying to do with these guys? But Malden was able to continue to draw, and throughout the rest of the war and even on the return home, he stuck to what he was trying to represent with these characters.
He won his first Pulitzer Prize for his World War II work. In 1959, Malden won a second Pulitzer for this cartoon. And he became an editorial cartoonist for the Chicago Sun-Times from 1962 to 1991. Perhaps his most famous image is a grief-stricken Abraham Lincoln reacting to John F. Kennedy's assassination. The museum and library are on the second floor of the historic Monroe Building on Michigan Avenue. The curator of the exhibition has a connection to the artist because he, too, was an infantryman.
I served in the Marines in Iraq, and the experiences that he represents through Willie and Joe in World War II are many of the same experiences that I went through, that I think infantrymen continue to go through, complaining about food, complaining about the weather. These are things that don't go away for those in the military. So whether you were a soldier in World War II, Korea, Vietnam, Desert Storm, I think his cartoons would speak to you. You look at his artwork now, and there are some of his cartoons that are relevant just as much today as they were when he drew them. We say that there is almost a Malden for everything, and if it was something that happened or something that happens today, it seems like we can find a Malden that addresses the topic.
For Chicago Tonight, this is Mark Vitale.
Bill Malden died in 2003 and is buried in Arlington National Cemetery. The exhibit of his work is called Drawn to Combat, and it just opened at the Pritzker Military Museum and Library. You can see more of the artwork on our website. And up next, a preview of this summer's festivals, so stick around.
Don't ever miss Chicago Tonight. Subscribe to our podcast. Get a daily download of our show delivered to your desktop or mobile device. Go to WTTW.com/Chicago Tonight podcast and subscribe.
Neighborhood street festivals, art shows, outdoor concerts. Remember those? Well, you'll be reminded of all the fun they bring when they return this summer as the Chicago area prepares to fully reopen. WTTW News reporter Kristen Tomitz joins us now with more. Kristen.
Hi, Phil.
So tell us what we have to look forward to this summer.
Yeah, so I'm happy to report this summer will look more like we've known before the pandemic. But there will be some differences at festivals. You can expect to see a lot more hand sanitizer stations. The artist and vendor booths should be more spaced out to allow for a little bit of social distancing. There will be some social distancing markers at some fests as well. And if you're going to a fest, you should pack a mask, because if you're not vaccinated, you're going to be required to wear one. And even if you are, some vendors may ask you just to put one on when you go into their booth.
So do we know more about how these organizers are getting ready for festivals amid a pandemic?
Sure. You know, one thing we learned, Phil, is things change a lot during the pandemic. So organizers are making multiple scenarios for each festival just in case things change, as it's been the case the past, 18 months. Some events have also kind of postponed their, coming back till later in the season, and some have just canceled altogether.
For those who have decided to postpone one more season, how come?
There's a couple reasons. These events do take a while to plan, and some even start right after the event has wrapped up. So that's part of it. Another is organizers have told me that some events just aren't financially feasible unless they're able to operate at full capacity, which is why some have, pushed events till later this summer and just said others said altogether, we'll just wait till 2022.
Makes sense. We'll be grateful for the ones that are happening. Kristen, thank you.
Thanks, Phil.
And you can read Kristen's full summer festival guide on our website, where you can find more on which events are set to take place this summer. It's all at WTTW.com/news. And up next, our own Jay Shefsky details an up-close encounter he had with a very friendly insect. Stick around. The award for Best Documentary Feature at this year's Oscars went to My Octopus Teacher. It's about a close relationship a man develops with an octopus. That got our own Jay Shefsky thinking about a cross-species encounter of his own just last fall. Here is Jay with another look.
This started like a lot of my favorite days, in a kayak on a quiet river. But soon it would get a lot more interesting. I was alone on the Paw Paw River, paddling out of Benton Harbor, Michigan. Wait, what is on that log? Is that a praying mantis? I don't think I've ever seen a praying mantis in person. Is it turning its head to watch me pass? I must be imagining that. I've got to get a closer look, so I turn around and sidle up to the fallen tree that is the praying mantis's perch. And this time, no doubt about it, it turns its head to face me. It is watching me. This giant insect that must have been the inspiration for the classic cartoon Alien is watching me. And it doesn't seem to be scared, at least not enough to fly away,
or walk away or whatever it would do. I'm a little scared, so before I get any closer, I Google, "Are praying mantises dangerous?" And I learned that while they can be quite rough on their prey, they're harmless to humans. So I get in closer, hoping to get a few shots before I scare it off. But it doesn't seem scared at all. It seems curious. I know, I shouldn't anthropomorphize this critter, but am I wrong to say that it seems every bit as interested in me as I am in it? Soon, I'm feeling ready to take our relationship to the next level. Will it read this gesture as a sign I can be trusted? Doesn't seem to make a difference. But then, after half an hour of just looking at each other, an amazing thing happens. It begins to approach. Tentatively at first, and then with a little more swagger. I'm glad I already confirmed that it's not a threat to me, because it's coming aboard. And then, for another half hour, it explores me and my kayak.
This is totally wild. There's a praying mantis on the bottom of my shoe that I can't even see it because it's on the bottom of my shoe.
It makes itself quite at home on this new perch. And soon it's ready to make the move to my hand.
That is the wildest thing.
But now I am in be careful what you ask for territory. Because while I know that this thing won't hurt me, it's tough to keep my cool as it moves from my hand to my arm.
Oh, now that's getting a little creepy. Ooh, jeez.
Even though I get it back to more comfortable territory, this giant insect still wants to be better friends. And then, as it explores me, it manages to find the one place I can't film it, on my hand that is holding my phone.
This is inches from my face, sitting on the phone that is taking this picture of me. It is magnificent.
When have I ever spent this much time, this close, to a critter I encountered in the wild, and which I think has come to trust that I mean it no harm? Unfortunately, I betrayed that trust. And I'm sorry to say that the rest of the story happened off camera. Here are some photos from earlier as I tell you how it played out. The praying mantis spent several more minutes on my hand and then startled me by quickly walking up my arm toward my face. I instinctively flicked it off. It landed in the water where I watched it flail as the current carried it downstream. I was horrified, and I couldn't let my new friend drown, so I took off after it, eventually using the kayak paddle to gently scoop it out of the water. Then, somehow, with that same paddle, I made my way to the shore, and here is my stunned friend on the paddle, just before I returned it to safety, and then watched it quickly take off into the brush. Did I teach it that humans can't be trusted? Maybe that's not a bad lesson. And what did it teach me? Something pretty simple, really. The benefits of quiet, patient observation. For Chicago Tonight, this is Jay Shefsky.
Boy meets mantis, boy loses mantis. We've heard that story 100 times, haven't we? Jay learned later that there are 2,400 species of mantis or mantid around the world. They come in a wild variety. A few other fun facts. Many species can turn their heads 180 degrees, like the one Jay met. The females have the charming habit of biting off the male's head after mating. Those dark spots in their eyes move to follow their prey. Some cultures attribute supernatural powers to them, and it is not uncommon to keep mantids as pets. And we're grateful to Luke Viator for allowing us to use those photos that you just saw. And that is our show for this Monday night. Please join us tomorrow night live at 7. State lawmakers wrap up the legislative session. We have a rundown on which bills made it through and which did not. And from cornrows to 3-strand braids, we're talking about the art of hair braiding and why it's more than just a hairstyle. Now, for all of us here at Chicago Tonight, I'm Phil Ponce. Thank you for watching. Stay healthy and safe. Happy Memorial Day. Good night.
Closed captioning for this program is made possible by Robert A. Clifford and Clifford Law Offices, pleased to give back to the community through numerous charitable initiatives.